Hello, my name's Mr. Vikram Dhar and I'm an ENT consultant surgeon working here at the One Ashford Hospital in Ashford, Kent. Tinnitus is, vast majority of the time, is subjective, so a noise that one hears in the ears that no one else can hear. And occasionally it's a noise that other people can hear, but the vast majority of the time, we've all heard it, different types of tinnitus. From pulsatile tinnitus, where it's like a whooshing, like your heart beating in your ears, to a constant noise that a person can hear. Tinnitus is incredibly common. Up to 10% of the population has tinnitus. And that's one of the problems we face, is that lots of people that suffer from tinnitus don't really find it bothering at all. But there are a significant portion that find it annoying and intrusive, and those are the sorts of people that we really want to try to help. So the vast majority of the time, tinnitus is related to some degree of inner ear damage. So the inner ear is the organ that looks after hearing. It's where the little nerve hair cells sit on the cochlear nerve. That's the nerve of hearing that can be damaged. We've all had the trouble when we walk outside a nightclub and our ears are ringing, and that's because there's been some temporary damage to the inner ear hair cells. If we can imagine the problems with tinnitus as a triangle, at one corner of the triangle we have the problem with the inner ear, as in there's been some damage to those little hair cells, so our hearing might have dropped. And then the other part of the triangle is what we call the auditory cortex in the brain. And that part of the brain is thinking, well, I haven't heard that sound so well at a particular frequency, let me try a little bit harder to hear. And the third most important part of this triad, if you like, is the deep part of the brain, the amygdala and hippocampus, and that's where the problem lies. I call it the sort of the emotional ladder of the brain, and we all prioritize things. Often it's our children that we're thinking about most, or our current illness, or worry about today. And sometimes tinnitus drifts up that ladder so it becomes more and more of a priority, and we can really latch on to it, and it can be very annoying. Patients will often say to me, when I'm trying to go to sleep, it's very irritating, I can't go to sleep. And it's about letting that tinnitus drop down that ladder so it's not so much of an issue. That's what really drives the annoying tinnitus. Yes, tinnitus, using the model I just described, can fade away into the background to the point that you're not even aware of it. Our brain has lots and lots, thousands, if not millions of inputs, the vast majority that we can completely ignore. A simple example, I'm sure most of you are wearing trousers right now and you're not aware of the cotton or the wool touching your leg, but that's because our brain completely ignores that sensation. But when it becomes a threat or a worry, for example, if there was something like a snake sitting on your leg, it would probably even though the same nerves are being stimulated, it would be the thing that you're most worried and thinking about the most. In the same way, tinnitus has an input to our brain. A lot of the time we just ignore it, but when it becomes a threat and a worry, it can become intrusive. It will go away and disappear into the background with the right treatment strategy. The first strategy is to see somebody, if it becomes worrying, to see somebody like myself that can give you some good advice. Often it's necessary to get a hearing test to ascertain whether there is a hearing loss, because that could be driving it, and often hearing aids can be of value. The next port of call is to ensure there's nothing else going on that needs further investigation, particularly in one-sided tinnitus. And of course, an ENT surgeon or a doctor alike would need to look into the ear to make sure there's no other issues. On a practical note, distraction's useful. Listening to the radio in the background, using a meditation app in the background so you're distracted by a different conversation or music is of use. Sometimes people use white noise generators, which I don't find that valuable, but it's all about shifting one's attention away from the tinnitus. My message to you would be that if you're concerned about your tinnitus, it's wise to see your doctor, and perhaps see a doctor like myself at the One Ashford in Kent, so that we can get to the bottom of your tinnitus and so you don't have to keep living with such an annoying condition.